A controversial proposition is in the works here in California, and it appears to now have enough supporters to get it on the ballot.
It would require doctors to submit to drug tests and make it harder for prescription drug abusers to get their pills. KCAL-9 political reporter Dave Bryan has details and reaction live from Culver City tonight. Dave?
Well, that's right, Lena and Sylvia. This could get on the ballot in November. I mean, it's likely that supporters may be turning in signatures as early as next Monday. It's a very controversial act, however, because in addition to requiring drug testing for doctors and also keeping an eye on how they're prescribing addictive drugs, it would also raise the cap on malpractice settlements, and that's the big issue.
Alex checked into an Orange County hospital to safely detox off of pain medication, and he died the first night that he was at the hospital.
Tammy and Tim Smick lost their 20-year-old son Alex 2 years ago when he was hospitalized in Orange County to be treated for prescription drug addiction after incurring a stress fracture in his back. They say he was repeatedly given powerful drugs on his first night in the hospital without being properly monitored.
He was administered 11 medications, including multiple central nervous system suppressants. He was left unmonitored without even one blood pressure check for over 7 hours. When the nurse finally checked on him shortly after 6 in the morning, he was found dead. How can a patient be given so many medications and then be left unmonitored?
The Smicks are supporting a Patient Safety Act, which supporters are working to put before the voters in November. But already the possible ballot proposition has triggered a fierce debate.
The referendum is flawed the way it's written because it has too much baggage in it.
Dr. Hector Flores is the co-director of the Family Medicine Residency Program at White Memorial Medical Center in Boyle Heights. He's cared for low-income patients his entire professional career. But he says this proposal is not what it appears to be. Although he says he sympathizes with families who have lost loved ones as a result of hospital mistakes.
Someone who loses their child, and my heart goes out to them because it's, I have a daughter, and if something happened to her, I'd be devastated. There's no amount of money that could replace my daughter. So the idea is really to find a better way to actually make sound public policy in this area.
The proposed ballot measure would require drug testing for doctors. It would change the system for prescribing addictive drugs. And it would increase the malpractice damage cap, which has remained at $250,000 for several decades. Dr. Flores says raising the malpractice cap could drive up health care costs dramatically and have some unintended consequences for doctors, neighborhood clinics, and patients, especially patients in underserved communities.
The impact, we think, is potentially we may have to lay off some doctors, we may have to lay off staff, or reduce the pay that we offer our staff. None of that is good for the community.
Doctors don't want to change. They don't want to be accountable to the same rules that you and I are. If a child dies in a car accident, a jury decides the value of their life and how negligent the driver was. If a child dies in a hospital, the cost is never more than $250,000 to a company like Kaiser, and that's not enough to change. I think the doctors who oppose this should be ashamed.
It will have an impact with more lawsuits, more costly insurance, and then the most adversely affected communities are going to be those that we're trying to help, which is the underprivileged low-income communities.
Well, this is such a controversy already that in Sacramento tonight, lawmakers have been jockeying around trying to work out some kind of compromise that would supersede the ballot proposition, a compromise between doctors and the lawyers. Excuse me. Senate President Darrell Steinberg was spearheading that attempt, but as of this evening, we understand no agreement has been reached yet. And as I say, on Monday, supporters are expected to submit over 800,000 signatures to put the issue on the ballot. We're live in West L.A. Dave Bryan, KCAL 9 News.